Yes, for sure. For sure.
It was something else.
And of course, our viewers are always very grateful to have you there.
Okay.
So it's, I think everybody should be excited.
Oh.
And of course, it's important to have important figures like you talking about serious issues and topics.
Yes.
So I'm always.
And it's amazing, I tried so hard in the prime.
Right. And good day to our viewers. My name is Gabrielle for MO News, and today we are with Miss Fedina Frampton of In the Spotlight, who is for the first time going to be interviewed as opposed to being the interviewee. Well, not for the first time, but she's usually the one asking the questions, but today MO News is proud to ask her the necessary questions, especially surrounding her recent bouts with the COVID-19 virus, which is something that I'm sure our viewers would love to know a little more about. So how are you today, Miss Frampton?
I'm pretty good. I am recovering pretty good as well. The thing about COVID is that, even when you get that negative test indicating that you no longer have the virus or it's no longer in your system, you still feel ill. So, it took me some time to even get to this point in terms of just responding to how I'm feeling, as you indicated. I feel fine. I still feel exhausted if I maybe overexert myself a bit. So let's say if I were to leave where I am now and I walk, probably a few minutes, I would have to stop and pause for a while and then, regain my composure. My breathing is still affected, so sometimes you might even during the interview it might happen.
Right.
I have to stop and take a deep breath and so on, and the appetite is returning.
Thank God. Okay,
Yes.
That's good. That's
Yes.
good. I know that's one of the symptoms that
Yes.
really
Yes.
lasts for a long time.
And
I'm
I'll
glad
give you a
know
joke
this.
about it.
Of course. So, can you tell us how long were you impacted by the virus?
I think I had the full 10 days, the full brunt of it. 10 days or maybe even more, because when I discovered that I had the virus, I was already sick.
Right.
So I don't know the exact time or day that I got it, but I know that I had it for an extended period of time, at least 10 days. Yes.
So you would have initially felt a little tickle in your throat, a little different than normal, that would have indicated to you, hey, something might be coming on, or is it that you just got it full force one day?
Okay, so I'll give you the background about
Of
this.
course.
So the Friday, I had to go to the dentist to have an extraction done. And when I went to the dentist, when I was done and I was leaving, I was coughing a little bit, but I just thought it was something that the doctor used that probably impacted me or probably reacted in some way, against my body. So I did not pay much attention to that. Then the Saturday morning, we were doing some cleaning at home, and then my boyfriend sprayed the room with insecticide for the mosquitoes. I was not aware because I was outside. By the time I came back in, I went to open the door without him having time giving me a heads up as to what he had done. And so when I opened the door, the insecticide just hit me in the face, and I started to cough profusely, right? Later on that evening, I started feeling a little ill, and into Sunday, I started feeling ill. I started feeling my body was aching. I started feeling my head hurting, a few things. So I said, okay, could have been something from the doctor's office, or maybe it could have been the insecticide that poisoned me. I literally said it poisoned me.
And listen, and your mind is racing and you're trying to wonder.
Exactly.
Right?
So the Monday, I continued feeling ill. I did not go into work. But again, in my mind, it's just something. I started taking some painkillers and so on. By Tuesday morning, I say, something is definitely wrong. I have to find out what is wrong. So I proceeded to the doctor. By that time, my body is aching. My head is aching. It's like a head cold. My legs are weak. I've started to lose my appetite. And I was just miserable. I was sick, and I was starting to get sick of being sick. I just didn't like the feeling of being sick.
Of course.
So I went to the doctor the Tuesday. And you know when you do not want to think it's what it is? So I give the doctor the story about going by the dentist. And that, I started coughing after, and maybe it was something from the dentist. And then I started telling him about the insecticide, and I think that I was poisoned.
And he was probably like,
yeah.
vagina.
Not yet. So we spoke about that. We spoke about a couple of other my other underlying issues. So with my medication and whatever the case is. So when we were kind of wrapping up, I said, "So doc, you're not giving me anything for the aches that I'm feeling?" So he said, "Your body is aching a lot." I said, "Yes doc, everywhere is aching. My legs are weak. I can hardly walk and so on." He started to laugh. And he said, "Fedines, you have COVID." So I said to him, "Doc, there is no way that I have COVID. I do not have COVID." He said, "Well, all what you're saying to me, I mean, put aside the insecticide, put aside whatever. I believe that you're sick with the virus." I insisted, no, because it's insecticide. I get a little poisoning from inhaling the insecticide.
The timing is just so odd.
Right. So then doc said, "No, we need to test you."
Right.
He did whatever he needed to do. And then he told me within a minute, no kidding, that first line that you see was pretty profound. So he said, "You have full-fledged COVID."
Oh my gosh.
I was not surprised, because in the back of my mind I suspected that I probably had it. What amazed me is that for a period of time I tried so hard in the prime of COVID, to not get COVID.
Exactly.
At some point I was even making jokes and saying, "Well, I'm almost sure I got COVID and probably didn't
realize, right?"
Well, hell no. I could not have gotten, if what I got over the past couple of weeks was COVID. I never got COVID before. I never got COVID before. So so the doctor told me, yes, you're COVID positive. Come back on such a day to be tested. You can do a home test if you wish on such and such a day. Make sure you take they tell you about the paracetamol. Yes. So the paracetamol, it did help, I must admit, for a temporary period of time. And then, I had my I got this COVID pack from Jolly's. I was taking my bush tea and the works.
I was about to ask.
But I don't know. I was vaccinated, by the way.
Right.
I was vaccinated. I got the Pfizer vaccine, yes.
Okay.
I was vaccinated. I didn't get boosted.
Okay.
But if what I experienced is a representation of what I got being vaccinated, I don't want to know what not being vaccinated would have been like.
Right.
Yes.
And would you say that being vaccinated was something of your own volition, or is it something that you would have been influenced by, people around you, or the media, or the CDC, or local healthcare officials?
Okay, so I was a bit reluctant about getting vaccinated at the beginning.
Here.
Yes.
Likewise.
I was, because I have underlying issues, as I said, and I had not yet been clear as to how the vaccine and those underlying issues work. And so I did my own research. That was important to me, to do some research. On the job, we got an expert, a Dominican based overseas, to speak to staff. I was able to ask him questions. And so following that session in particular, I got the green light to go ahead and get vaccinated. And I waited for when the Pfizer came in. And I decided to go with the Pfizer vaccine, and I was happy. I got pretty sick.
Right.
Oh my God.
Because again, your body is developing that immunity.
Listen.
But not as bad as when you got the COVID.
No, but I felt like I was ready to die. I was ready to go to the hospital. Head cold, headache, trembling, fever. My body was something else.
Yes.
But within, I got the same symptoms and experience for 3 days in free same days.
Okay.
So let's say Sunday I got it, the next day, the Monday and the Tuesday. So I got the same things, a little lesser as the days progressed.
Right.
But by the third day, that is when I got vaccinated.
Right.
By the third day, I was generally fine. And after that, I was
so
fine.
your natural immune system kicked in and was like,
it was something.
we've gotta get your body used to this.
Yeah.
But again, with all the variants of COVID-19, sometimes your body has developed an immunity to maybe the first strain and then the new strain. I'm not sure what they're calling it, the Delta, right? The Delta, the Beta, the whatever
Omicron.
Greek alphabet letter they're using right now to qualify the COVID-19 virus. We're thinking to ourselves, we're immune to all of it, but really and truly, these variants can come and affect us at any time.
Absolutely. And I really didn't think that I would get COVID. In my mind, to share with you, in my mind, COVID was practically on its way out, at least where Dominica is concerned.
Yes.
And then I remember when I went to the doctor, he said to me, in one day, a couple of days before, he did 3 COVID tests of people who said that they were all positive, who said that no, they don't have COVID. So I know that COVID is still very much present in Dominica. And again, as I said, I didn't expect to get COVID at this point, but I did. And my COVID experience was hell. I think COVID is of the devil, if you ask me. The body pains, I remember for a few days just curling myself up in a corner of the bed and just groaning and moaning because I was in so much pain. I would try to stand up and my legs would be weak, my head hurted, tension in my eyes. It was really a terrible experience. One of the main parts for me was my appetite.
Right.
I lost about 14 pounds, no kidding.
Right.
I could not eat. Nothing tasted good in my mouth. So I may say, oh my God, I would like a salad. And COVID would say, salad? What you talking about? What salad? Taste for salad.
Right.
Salad gone.
Lettuce tasting bitter in your mouth.
Yes, you'd say, okay, maybe I could try, a piece of pizza or something. The minute you think about it, COVID is saying to you, what pizza are you going to eat there? I'm serious, Fruits worked for me a bit. So, I was able to have some fruits. But,
coconut water?
And coconut water.
Yes,
I got coconut water worked very well for me. But generally it really cuts your appetite. At least, I don't know, I guess people experience different symptoms, but it really cuts your appetite and you're just not able to eat. And if I tell you I lost about 14 pounds in just over 10-12 days, then that should tell you
serious,
how bad it was. What it does to you as well is that, at least what it did to me, all you want to do is sleep. You just want to lay down and sleep and just lay down. You don't want to get up to do anything. It just takes over you. It takes over you. It takes over your body. And I do not wish it on anyone. I know millions of people have gotten it, around the world, but I still don't wish it on anyone. And I definitely do not want to get it again.
Listen, it's taken so many lives. It's affected the lives of so many people.
Yes.
There are people to this day who would have contracted COVID in the earlier stages when it became prevalent in 2020. And to this day, they're still experiencing the loss of taste in their mouth. They don't have appetites like how they used to. Some of them would have even had more adverse reactions because they have underlying conditions, as you would have said. So it's something that is definitely still plaguing us. We should definitely consider it. I know, for example,
you see what just happened,
exactly,
right? So, and this is one of the things that's
out
bothering
of concern,
me.
I was like,
no, you can ask. Oh my,
are you okay? Are you
I'm
okay?
fine. But that happens, and then it's like a dry cold, and it's like you force it to try to get it out. And so that is something that one of the things that's lingering in terms of what COVID has left behind with me still. The breathing situation, and as I said, the appetite is still slowly returning. Hey, but I don't mind the pounds that was lost. I'll tell you that much.
That's the one plus.
What I should do is try to build on that and lose some more. What you think?
No, man. Of course, I know that the COVID-19 virus has definitely impacted the way a lot of people would have seen how it is affecting a lot of people. So, for example, I myself maybe wouldn't have gotten COVID again. Like you, before you would have gotten this exposure to the virus, I would have thought to myself, maybe I got COVID and I didn't know.
Yes.
And now I'm hearing your first-hand experience, and I'm thinking to myself, well, okay, how I think it is probably not how it is at all, because these things that you're describing, they don't sound new to me,
Right.
but they sound totally different from what I've been hearing.
Yeah.
People are saying that they would have gotten it and they would have tested positive, but they didn't get anything serious. But to experience the full brunt of the virus,
I got the full brunt. On certain days, this virus has its own way of doing things. So on the body pains were constant, so that was throughout. The feeling of weakness and fatigue and tiredness, that was constant throughout. On certain days, I would get up and then I have to go to the washroom.
Yes.
On certain days, I would get up vomiting.
Yes.
On certain days, you'd probably get up just feeling stuffed and your nose, runny nose and coughing and all of that. So some of the symptoms would be exposed on certain days, and other days you don't see it, and then other days it probably returns, or there are days that all of them just give you their beating. Yeah. It was, and I mean, this is no exaggeration that I'm talking about here this afternoon. That's why when Embo asked me if I would be willing to speak about it, that I agreed, because I felt at times that I was literally dying.
Right.
This is no joke, you know. And my boyfriend really made the effort to ensure that he was present in case anything happened, that he needed to rush me to the hospital. So anytime he had to be at work, he's at work. But other than that, you know, I'm here. I'm in my own space. They're in their own space. Nobody else in my household got it. So thank God for that. So we were able to manage that properly. So thank God for that. But try to avoid getting COVID. If the mask mandate is still in effect, please continue to use your masks. It's still not too late to even get vaccinated. No. It's still not even too late to get boosted, because COVID is not easy. And I think there may be a lot of people out there with COVID and probably just saying that it's the flu, it's the common cold or something. But no. And people still need to get tested. I know there is not the main forum where people used to get tested before, but you need to go to the doctor at least, or go wherever.
Especially if you're experiencing symptoms.
Yes, you have to. You have to, and you have to be careful as well in terms of exposing the people around you, the people in your workplace, the people at home. You know, if you get the symptoms, you should get tested and just ensure that is clear. So it's either you have it or you don't have it, or you just have to come on cold and you take whatever you take for the flu or for the cold, whatever the case might be.
Of course, it's important for us to know, like you know your status with non-communicable
That
diseases
is
like
correct.
diabetes and hypertension.
Correct.
Like you know your status with HIV, STDs, whatever the case may be. Know your status with COVID. Know your status with COVID. And we shouldn't also allow the fear of other viruses like monkeypox and stuff too deter our efforts in fighting COVID, because it's something that is still affecting us, like you said. As well, I wanted to inquire just before we, wrap up. Would you have received healthcare assistance from our local healthcare facilities, for example?
For when I got COVID?
Yes,
no, so I went to the doctor.
Yes, your private physician.
My private physician,
okay.
Yes. I was confirmed positive. He gave me my guidance and whatever the case is. I went home and I recovered from home.
Right.
Yes.
So persons that are, skeptical about, I don't want to go to the hospital, I don't want to be on the ward or whatever it is, they don't have to worry about that.
Well, I don't know how that works though at this point in time. To be honest with you, I'm not sure what the update is.
Okay.
All I know is my doctor sent me home.
Sent you home and told you to isolate yourself.
Yes, and do whatever I needed to do, and I followed his instructions, and it worked. My family didn't get impacted, and
you're here with us today.
And I'm here today.
And you're here with us today,
Yes.
and we're so grateful that you're here
Yes,
with us.
definitely. Gosh,
It's something that it sounds like an ordeal that
it is an ordeal. It is, you can't do anything for yourself, really. I mean, you have to go to the shower. You have to do whatever you have to do.
Right.
But other than that, you cannot cook. You cannot do none of that.
Nothing.
None of that. I remember trying. Well, your phone is in your hand. You can do your little social media. You can do your little whatever. But to say go open a laptop, and let me tell you, in terms of the aches and pains, there's a backache. I don't know if you've heard about the backache. The backache is the worst.
No.
It's the worst.
Let me one get my books.
Yes.
No, because
The backache is the worst, so you can hardly sit up.
Backache.
You can hardly sit up, but even when you try to lay down, yes, the backache was bad. The backache
now we're
was bad.
thinking, now the thing is, we're thinking that it's called the loss of appetite, but the pain that you are describing to me, no. As a woman in particular,
Yep.
you know when you have to deal with PMS and then your
Yes,
menstrual
yes.
normal aches and pains,
Uh-huh.
that's
Yeah,
okay.
yeah.
COVID can stay where it is. It can stay where it is. That's totally fine.
Yes,
But is there anything that you want to say again?
Well, first of all, people might say, might think, why am I coming to talk about COVID and that kind of thing, and probably somebody like me, they wouldn't
Right.
expect me to come to talk about COVID. Why not?
Why not?
I really didn't mind sharing with people my COVID experience, and for me, it's about still encouraging people to be careful,
Of course.
to be cautious, to wear their masks, especially the elderly people. What I experienced, I try to imagine an elderly person with accompanying underlying issues. I try to imagine what they would have been experiencing, and I know that it is crazy. So let's protect them. Let's protect the children.
Agreed.
Let's protect ourselves in terms of COVID. Wear your masks. Take your vitamins. I think
Right.
taking your vitamins in advance.
Drink your bush tea.
Yes, drink your bush tea. Do whatever that you
Sanitize your
have to do.
hands when you go in.
Sanitize your hands.
Listen, my
Let's
bottle of
not
sanitizer
forget.
doesn't stay
Yes,
down.
yes.
Your bottle of sanitizer cannot stay down. You cannot always think to yourself, I'm going to a restaurant, the place have sanitizer. No, walk with your own. You don't know whose hand you're going to shake, whose money you're going to touch. Whatever you're going to have to do, you need to ensure that you're taking care of yourself.
And I
Totally
really want
agree.
to say that don't think that there's no COVID in Dominica. COVID is still very much present in Dominica.
Persons are
Yeah.
persons are relatively upset when they hear you say, I'm not taking off my mask, or please wear your mask. I remember the other day I entered a store and they told this young man that he had to put his mask, which he had in his hand by the way, and he's like, put mask forwards. He's like, put
No.
mask forwards. You don't have COVID, or you just saying thing, or you now they have to take out
I'm
that mask
evidence.
mandate.
There's very much
There's
still
COVID. There is COVID. I mean, you don't live in fear.
Yes.
You don't allow it to restrict you from living your life, doing what you have to do. You just have to exercise caution. You just have to exercise caution.
That's it.
You just have to be very cautious, of course. And of course, any final words from you, Fedina? I know it's Miss Frampton.
Yes.
I know it's it's been a difficult journey.
Yes.
But again, we're grateful that you're
Oh
here.
yes,
with
I'm
us.
grateful that I'm here too.
Of course.
And I don't know if I am able to mention, but I understand you're moving on. Can I?
Yes, if you would like to. of
Just a
course,
little,
of
just to
course.
wish you well.
Thank you so much.
Emo in her own special way, I guess, will make say
Of
whatever she needs to
course,
say
of
at some
course.
point. But I really just want to wish you well.
Thank you so
And
much.
this young lady here behind, she decided to stay behind
She
the camera
started- yes, of
today,
course.
But I just want to continue to encourage you,
Mm-hmm.
Emo, to continue doing what you're doing. And I know God will just continue to bless you. As we were driving to come here, I was just saying to you, I hope that God continues to protect you on your journeys when you go in near or far to do what you have to do. And again, to tell you, we did our interview the other day and I told you so, but I really want to tell you that I appreciate you and Dominica appreciates you.
course, of
And
course.
Gabby, I think you're a gem.
Thank
I think you're a gem. I think you're pretty good at what you do.
I try my best. I learned from the best. Emo herself. Emo herself. She's
Wonderful.
the best. I'm usually behind the camera, so a lot of persons, people will hear my voice and they'll say, I heard your voice.
see.
But a lot of people don't know that I'm working for Emo. I'm doing this for Emo. And that's mostly because when we're moving to move.
Yes.
Emo allows her staff
Yes.
the how should I say? Emo allows her
Freedom.
staff the freedom and flexibility to work in different areas and to do different things. So we don't just cover funerals, we do interviews. We don't just do funerals and interviews, we do business promotion. We don't just do small business promotion, we promote the businesses that are already established in Dominica for years and years and years,
Yeah,
and
good
will be there
work.
for years to come.
Emo
We
News
try our
does
best.
good
And
work.
Emo News, of course, our followers know we are the number one digital marketing experience. The number one digital branding
marketing experience.
digital branding experience, the
That's
number
it.
one digital news experience. And of course, in terms of reporting, we want to also thank our viewers and for being our eyes and ears everywhere in Dominica. We have our people, you know, they will take their phones and they will see an accident, and MO News hasn't arrived on the spot yet. And they will take their phones and they'll be like, and this is MO News recording. And it's awesome.
Yes.
It's an amazing
household name.
Of course.
You know, people just loving the vibes and
Yes,
appreciating
of course.
it.
Little
So
children
good
will see
job
us
to you,
coming
my
with the
darling.
tripods.
I think we maybe have to wrap up now.
Of course.
Let me just invite persons to
Yes.
tune into In the Spotlight on Monday nights on Q95. And also we have the In the Spotlight TV series. I think we just have 3 more programs to air.
Right.
And then we'll take a break and probably around Christmas time because, you know, the schedule is building back up again.
course.
So we can only do so much within a
Right.
certain period of time.
Right.
Emo, thank you. And thank you to your viewers. And thank you, Gabby,
Of course,
for a
thank
wonderful
you, Miss
interview.
Frampton, so much.
All
You know,
right.
kudos to our viewers once again, and thank you for tuning in to MO News. Please have an amazing rest of your day. Have a blessed week, and continue to stay blessed. This is MO News signing out.